Hi there, did you know that a recording of a man's brainwaves at the time of his death showed patterns similar to what occurs during dreaming, memory recall, and meditation? Around the time of death, the EEG recorded changes in gamma brainwaves and other types of brainwaves. Let's find more information in the video. The man was in the hospital after developing epilepsy after a fall. During an EEG scan, he had a heart attack and died. A team of scientists inadvertently recorded the brainwaves of an 87-year-old patient as he died, providing the first glimpse at what happens in the brain during the final moments of life. The man's brainwave patterns in the 30 seconds before and after his heart stopped beating were similar to what occurs during dreaming, memory recall, and meditation. The man was in the hospital after developing epilepsy after a fall. While doctors were using continuous electroencephalography to detect his seizures and treat him, the man had a heart attack and died. Around the time of death, the EEG recorded changes in gamma brainwaves and other types of brainwaves. Through generating oscillations involved in memory retrieval, the brain may be playing a last recall of important life events just before we die, similar to the ones reported in near-death experiences. Study author Dr. Ajmal Zemer, a neurosurgeon at the University of Louisville in Kentucky, speculated in a news release, "Can a brain scan tell if you're lying? Experts say a functional MRI is more accurate than a polygraph." However, more research needs to be done before judges will allow the tests to be used as evidence. Searching for the truth is the very definition of what happens in criminal court. Forensic science has long assisted in that quest. However, other scientific tools, polygraphs, brain scans, and functional magnetic resonance imaging remain largely inadmissible as evidence of guilt or innocence. Some medical experts believe that could change if larger trials are conducted outside the laboratory in real-world conditions, using strict protocols that yield reproducible results. Dr. Daniel D. Langleben is one of the leading researchers in the field of lie detection. He is Associate Professor of Psychiatry in the Perelman School of Medicine at the University of Pennsylvania and a staff physician for the Philadelphia Veterans Administration Medical Center. Does Langleben see a future use for fMRI in court cases? Yes, he told Healthline. But what stands between this being an educated answer with data behind it and an educated guess is we need to have larger-scale trials that test real-world situations under controlled conditions. Until this happens, my answer would be a guess. Right now, he continued, we have the polygraph, which does have a level of accuracy significantly above chance. There are some people who would say that the polygraph is 100% accurate. But the literature as a whole, including the report by the National Academy of Sciences, points to a number in the 75% range. So, the polygraph is already pretty good but not good enough for real life, meaning clinical applications. If the fMRI could improve on that, it means there is a way forward. An fMRI was at the center of a high-profile murder case in Maryland. The defendant, Gary Smith, a former Army Ranger with 5 combat tours in Iraq and Afghanistan, was on trial on charges of killing his roommate. Smith's attorney hoped that his client's fMRI would prove he was telling the truth. The judge presiding in the case said he found the fMRI fascinating but refused to admit it as evidence. Langleben and Jonathan G. Hackman, Ph.D., an assistant teaching professor in psychology at Penn State, published a paper trusted source in 2016, Polygraphy and Functional Magnetic Resonance Imaging in Lie Detection, a controlled blind comparison using the Concealed Information Test, in the Journal of Clinical Psychiatry. We showed a 12 to 17% difference between polygraph and fMRI. In favor of fMRI, Langleben said, fMRI could be used for lie detection and it could be better than polygraph. But it would not answer one key question. Will it ever be good enough for legal implications? Because there we require a completely different level of accuracy. However, it's impossible to know based on the EEG what the man may have experienced in his mind at the time of death. In addition, these findings challenge our understanding of when exactly life ends and generate important subsequent questions, such as those related to the timing of organ donation, said Zemer. The researchers caution against drawing broad conclusions based on this study, which involved only one patient. In addition, the man had epilepsy with swelling and bleeding in the brain. Traumatic brain injury and white matter damage can influence rhythmic brain activity, the authors wrote in the paper. The study was published Feb. 22 in the journal Frontiers in Aging Neuroscience. Similar response seen in rats at time of death. In a 2009 study, researchers from George Washington University made EEG recordings on 7 patients who were critically ill at their time of death. They found an increase in electrical activity in the brain that occurred even when there was no detectable blood pressure. Patients who suffer near-death experiences may be recalling the aggregate memory of the synaptic activity associated with this terminal but potentially reversible hyposemia, they speculated in the paper. In a 2013 study, another group of researchers saw similar changes in gamma brainwaves in rats at the time of death as occurred in the most recent study. Within the first 30 seconds after the heart stopped beating, All of the rats displayed a widespread surge of synchronized brain activity associated with a highly aroused brain, they reported. We were surprised by the high levels of activity. Study author Dr. George Masher, assistant professor of anesthesiology and neurosurgery at the University of Michigan, said in a news release at the time. In fact, at near death, many known electrical signatures of consciousness exceeded levels found in the waking state, suggesting that the brain is capable of well-organized electrical activity during the early stage of clinical death. Zemmer said in the release that he plans to investigate similar cases. As a neurosurgeon, I deal with loss at times, he said. It is indescribably difficult to deliver the news of death to distraught family members. Something we may learn from this research is that although our loved ones have their eyes closed and are ready to leave us to rest, their brains may be replaying some of the nicest moments they experienced in their lives. How to test brain scans. A radiologist agrees with Langleben on the need for advanced testing of fMRI outside of the laboratory. Dr. Pratik Mukherjee is a professor of radiology and bioengineering at the University of California, San Francisco, and director of the Center for Imaging of Neurodegenerative Diseases at the. Since this would constitute research, the admissibility of any results in court would be questionable until the testing is fully validated. This is similar to the ethical barriers to using the results of research studies for clinical practice in medicine. Mukherjee said certain standards must be met before the doubts and objections to the admissibility of fMRI in court cases can be overcome. Accuracy. It must have acceptably low rates of false positives and false negatives. Reliability. It must have acceptably low rates of failure. Generalization. Does it work in people of all ages and IQ levels? Those with mental illness, those under the influence of psychoactive substances, and those with prior head injury, stroke, dementia, and so on. Robustness to countermeasures. Simply moving your head slightly during the scan is enough to degrade any fMRI. Better brain imaging methods are needed, and a lot more scientifically rigorous testing, including under real-world conditions, Mukherjee said. Even much of the current scientific literature using fMRI for academic neuroscience research is suffering from a failure of reproducibility. The emphasis now is on improving fMRI methodology to produce more reliable and reproducible results. How will Langleben test fMRI outside of the laboratory? Very similar to the way they use polygraph in Japan, he said. Someone with appropriate expertise will study the case and assemble a forced-choice questionnaire with questions that have clear yes, no answers that maximize the difference between a likely perpetrator and the person being tested. Results of the analyzed data will have a quantitative estimate of the effect size, the strength of the difference between lie and truth, he said. We hope you enjoyed it. Don't forget to subscribe to my YouTube channel for interesting videos like this.